بسم الله الرحمن الرحيم. أبنائي وبناتي الأعزاء طلاب كلية الطب جامعة بحري، السلام عليكم ورحمة الله تعالى وبركاته. أينما كنتم، لعنة الله على الحرب التي شتتت شملنا وفرغتنا. معكم عمكم دكتور عمر نميري، أستاذ الطب الباطني بالجامعة. حقيقة قبل أن أبدأ معكم محاضراتي أود أن أطرح عليكم بعض الأسئلة ولعل أن تجدوا لها إجابة، خصوصا أنتم الجيل القادم الذين سوف تحملون الراية من بعدنا. لماذا قامت هذه الحرب؟ وما هي الأسباب التي أدت لاندلاعها؟ وكيف سوف تتوقف؟ فعسى أن تفكروا في هذه الأسئلة وتجدوا لها جوابا. طيب, today I'm going to start with you lecture on tropical medicine. You know that tropical medicine could be caused by bacteria, by viruses, by reticular, by protozoal, by a lot of pathogens. Of course, I am not going to discuss all the tropical diseases, but I'm going to discuss the most common tropical diseases, and I'm going to start with clinical problem. A 35 years old man from Al-Gadarif presented to the hospital with fatigue, fever, loss of weight. On clinical examination, he is ill, underweight, and has a huge spleen below the umbilicus, and he was very pale. What could be the most probable diagnosis? Of course, as you know from Sudan Foundation lecture, it is most likely that the Al-Gadarif area is endemic in, of course, Leishmaniasis. So this is most probably a Leishmaniasis. So Leishmaniasis is caused by intracellular protozoan caused Leishmania. As you know, there is 21 types of Leishmania species. It can cause facial leishmaniasis, which we call calazar, or cutaneous leishmaniasis, or mucocutaneous leishmaniasis. We are going to start with facial leishmaniasis. It's caused by Leishmania noviae, common in Sudan, India, Bangladesh, Brazil, and 90% is transmitted by sandfly, but also it can be transmitted by blood transfusion and intravenous drug users. Leishmaniasis can be zoonotic, is that to say transmitted from animal to the human, like Leishmania infantum, Leishmania major, Leishmania mexican, and Leishmania brasiliensis. Or it could be orthoboonotic, that to say transmitted by Leishmania noviae from human to human, like Leishmania noviae or Leishmania tropica. Or it could be orthoboonotic, that to say transmitted by intravenous drug user, and this usually there is co-infection with HIV, and like Leishmania infantum. This is the life cycle of Leishmania inside the sandfly. The clinical picture: usually adult and children are equally affected. Incubation period is from weeks to months. First signs is high-grade fever with chest arrhythmias, splenomegaly, develop rapidly and usually massively in life, and also there is moderate hepatomegaly, lymphadenopathy, especially epithelial lymph node, blackish discoloration of skin, and from here the name calazar, which is Indian word, means black people. Anemia is usually moderate to severe. Thrombocytopenia is common, and this may lead to nasal bleeding. Hepatic dysfunction and hypoalbuminemia may lead to pedal edema. Immunosuppression, this make the patient susceptible to TB, dysentery, boils, and pneumonias. Investigation: usually pancytopenia with agranulocytosis and monocytosis. A mastocytosis may be revealed from splenic puncture, but this is hazardous and can cause massive bleeding. LD bodies usually from bone marrow or lymph node smears. This is the investigation of choice. Also PSR, ELISA, an immunofluorescent test, and high sensitive direct agglutination test that is very simple and cost effective. This is a mastocytosis in splenic puncture. Differential diagnosis: malaria, typhoid, tuberculosis, schistosomiasis, and lymphoma. Of course, malaria can cause huge splenomegaly and anemia, but it never causes lymphadenopathy. Typhoid is not a cause of lymphadenopathy. Tuberculosis can cause lymphadenopathy, but never huge spleen. Schistosomiasis can cause huge spleen, but never lymphadenopathy and lymphoma. Treatment: antimonial compounds like sodium stellobugluconate 20 mg per kilogram body weight, or meltoguliumine antimonial IV or intramuscular for 28 days. Side effects can cause arthralgia, myalgia, hepatic dysfunction, cardiotoxicity, prolonged SC segment, and which is usually concave. Amphotericin B deoxycholate once or alternate days, 0.75 to 1 mg per kilogram body weight. Rigors, side effect can cause rigors, fever, renal and hepatic dysfunction. Ambisome, which is lipid formulation of amphotericin B, is less toxic. Other drugs: oral meltofosine 50 mg per day, pentamidine isocyanate, and the response is usually by the fever will be subside as spleen regress and the patient will start to gain weight. Post-Caldara dermal leishmaniasis. After the treatment of visceral leishmaniasis, 50% of patients develop dermatological manifestation in the form of macules, babules, nodules, plaques, and the treatment is sodium stellobugluconate for 120 days. This is cutaneous manifestation, and prevention of visceral leishmaniasis by sandfly control and mosquito nets and treatment of infected persons. HIV among visceral leishmaniasis co-infection. HIV cause immunosuppression, that is increase the risk of contracting visceral leishmaniasis by 100 to 1,000 times. Liposomal amphotericin B is the most effective treatment. Treatment of cutaneous leishmaniasis by topical application of paromycin 5% or methyl benzosonium chloride. Thank you.